Welcome to An Hour to Give, and this time every week we get together and speak about philanthropy and community and volunteerism. And a fantastic friend of the show has been the Ottawa Hospital, and they're doing incredible things. And we get to speak about many different events today, including Run for a Reason and The Ride. And I am over the moon to welcome to the show Dr. Sony Singh. Welcome.
Thank you very much for having us.
You are one busy doctor, and to take the time out today to join us on An Hour to Give, we're very grateful.
Oh, it's my pleasure.
So Run for a Reason is coming up, and you're part of that. Tell me how you got involved.
Well, the Run for a Reason was an easy thing to get involved in. It mixes two of my passions. First of all, I enjoy running, and I've been doing half marathon and marathon distances for many years. And when I learned that I could mix that with my second passion, which is women's health, it worked out perfectly. And so now I can run every race weekend, which I've done for almost 10 years, and then at the same time raise money for an important cause.
And you're captaining a team, which, of course, Run for a Reason, happening on May 25th and 26th. And the name of your team?
So it's minimally invasive gynecology. It's a mouthful.
It is. But you know what? The bottom line is you really want to help women and alleviate the discomfort and the pain they would have from a number of different conditions. Can you share a little bit about what you're doing at the Ottawa Hospital?
I think the big picture aspect and one of the values I really feel strongly about that the Ottawa Hospital has helped us develop is how I would want my own loved one to be treated, whether that be my wife, my daughter, my mother. And that's what I take to work every day. And so women's health is my passion. That's what I've devoted my whole career into. And the conditions we focus on include endometriosis, uterine fibroids, and chronic pain. Conditions that don't get a lot of time on, radio or TV, but are extremely important because they're really common. And so my job is to get awareness out there so that we can provide better care for these many patients.
I mean, there's so many different angles to this story, and I think one of them is really interesting, and I'd love to learn more, is the 3D uterus. Can you share a little bit about that?
So the uterus itself, well, all uteruses are 3D. We have a great project that we've organized with our Department of Imaging here at the Ottawa Hospital, and they have a 3D printer, which was also actually supported by great donations from the community. And when I met with the leads there, our research team and their research team got together. We said, you know what, we can really make a big difference to women's health care if I could actually see this uterus in advance to doing surgery. And usually the surgery that we're doing it on are, or cases we're using it for, is uterine fibroids. Up to 80% of women have fibroids in their lifetime, so super common. And about half of that number are affected by it, whether it be infertility, not being able to get pregnant, or heavy menstrual bleeding and pain. But in young women who want to save their uterus in order to have children later on, trying to take out those fibroids can be quite challenging and difficult. So now, at the Ottawa Hospital, we were one of the first ones in the world. We've printed these models, and we can now plan how to save this uterus so that a woman has an opportunity to have children in the future.
That is simply amazing. And to think, I can't, every time that we have the Ottawa Hospital on, we hear that very same sentence, the first in the world. We are the first in the world. This is just another example. It's incredible.
You know what? It's a fantastic, there's a vibe at the Ottawa Hospital, which is the reason I came here more than 12 years ago, that really helps push that. When you have other great colleagues who hopefully you're going to be chatting to shortly, working alongside you, it makes you want to work harder. It makes you want to provide better care because of the values that are instilled. And this is just one example where we got two different departments, two different research groups working together to provide care for each individual patient as they walk through the system.
And you made a really good point earlier, too. You've got the incredible skills, obviously, and you're a talented doctor, but you need donors to be able to really come to the table as well and provide you with the tools that you need to be able to save and change lives.
Absolutely. You can be a great clinician, a healthcare provider, but unless you go out there and educate the public, and then garner support to move what you know is right, that we can provide less invasive treatment to women, we can help them achieve their dreams, which is less pain, fertility in the future, whatever it is that their goals are, that you can help them. You need to get that word out, and in doing so, then you can hopefully get the donations necessary to buy the best equipment to keep you at the cutting edge and allow you to compete with other great centers as well, because our own community needs and deserves that excellent care that we can get anywhere else in the world. And I'm proud to say at the Ottawa Hospital for Women's Health, we have fantastic care.
Well, and it really speaks to run for a reason. And the reason to run is for, the women in your life and making sure that they're cared for.
It's not just about today, it's about tomorrow. And that's why I always bring it back to encouraging others to think about what would they want for their own family. And I want to know that my daughter in 20, 30 years has access to the best care in the Ottawa region, and we're setting the foundation for that every day.
Your team is incredible. I understand that you have a donor who will match up to $15,000.
Yes, it's been great because, it's not easy. There's a lot of people who need money, especially in our fiscal environment, so I understand that. But we're hoping that we can encourage those who really feel that they want to support a cause like ours, which is women's health and women's health research in gynecology specifically. And then we had a donor who said, you know what? You raise $15,000, and I'll support you another $15,000. It's been an incredible outpouring of support, and this has happened in the past as well, and I know it'll happen in the future. So we need everybody to, consider donating to whatever cause it be, whether it be this cause or the other many teams we have set up.
Well, in the Tamarack Ottawa Race Weekend, it's been around for a long time. Each year it just seems to get better and better. And, teams like yourself and, raising this kind of money to be able to go back to the Ottawa Hospital is just an opportunity for everyone to get involved.
Here's the other great thing. You should join a team, regardless of, what the cause is. But if you join a team, there's a secondary benefit. We've created runners for life. Right now in our team, we have walkers and runners, but I've had people who've joined our team, some of our nurses, some of our patients, who then say, you know what, I didn't even know running would be that great. And they've gone from starting at a 5K now to running full marathons. And I think, it's a healthy way to get involved, give back to the community, and the self-improvement that happens. It's just over a month away, and you can only imagine that in that month there's great training you can do, get healthy, and at the same time have benefit to your community.
It's so true, because everything from 2K right up to marathon, it really is for everybody. And I go every year with my daughter, and there's an incredible vibe to the city, and it really is about health and giving back.
When you get those high fives as you go through the different communities in the Westboro, and you see the kids who are really cheering you on, it really inspires you to want to work harder. And then the thing that drives me and why, I don't always want to run 21K, but is I think about the patients. When they're struggling in that, the pain they have, the suffering that they have, and then I'm feeling that pain in the last 18K, but if they can do this, if they can get through and we can make their lives better, and they've been struggling for so long, then all of us can make a run and raise the money needed.
We're speaking with Dr. Sony Singh, and of course, you're a surgeon, and you're also the chair of surgical gynecology at the Ottawa Hospital. It's a really big role. What would you say to donors that are listening that have donated to you and to the Ottawa Hospital, or maybe they're thinking about making a gift?
Well, first of all, thank you for being involved, and know that in this environment that we have now, every little bit matters. And your support, whether it be the letters we get or the financial support, makes a huge difference. And in the end, there are many teams to support, but for our team specifically, we think that our mission is to make lives of women and girls better through the less invasive means that we can. And the Ottawa Hospital, who's been a leader in that, wants to continue, but also develop new research programs so that we can get people back to work, back to school, back to hosting radio shows as soon as possible.
That's great. And May 25th and 26th, of course, race weekend. Dr. Singh, are you going for a personal best this year?
I am. Every year I get older, and I figure, I can't beat my last one. But this year specifically, I'm working harder to get my personal best. But at the same time, again, it's two missions. One is to do my best at the run, but remember, what drives us is that we can provide better care. So can I provide better care to my patients tomorrow? And after race weekend, I hope to be able to say yes.
Well, and I've been so grateful, obviously, to chat with you today. And following this, I get to speak with one of your patients, Chantel, and she's going to be also inspiring us to give back to the Ottawa Hospital and, of course, to support Run for a Reason. Really appreciate your time today.
It's been my pleasure. Thank you so much.
Thank you so much. And stay with us on An Hour to Give as we explore all the different ways that you can help the Ottawa Hospital. Stay with us.